Thank you so much. I'm so glad to be here today. I really started planning this project right towards the beginning of the pandemic, when everything was just ramping up. I actually really thought of this when I saw a video on the news that featured a man standing outside of the hospital window of his wife's cancer treatment center with a big sign because he wasn't allowed to go in and support her. And this really moved me, as I have family members who have had various cancers. For example, my first cousin had leukemia when he was just 13, and my grandmother had breast cancer. So I was really thinking about how difficult it must be to not have your support system be able to be right by your side during this time. And so I thought, here's a big problem, and maybe I can do whatever I can to ameliorate it. So if not being in person with people, the next best thing would be through devices and through FaceTimes and Zooms and all these things that we've been doing now. And so I reached out to, as a member of the Student Leadership Council, my advisor, Samantha Scarpa, who works for LLS. She put me in contact with you guys here at this hospital, and I'm so grateful to be able to bring these today. I really just want to highlight that I think there's been a lot of attention and awareness about the increased health risks of COVID-19 to cancer patients, but not as much focus on, that emotional and mental health side that is still so important. And I wanted to make sure that, using these devices hopefully can help people stay in better contact and feel like they have that emotional support. And then also for kids, I learned that they might be used for like entertainment and such during in between treatments as well. So I really want to thank everyone who's donated, and thank you guys for having me here today. I'm really glad to be able to do this.